Hi, my name is John Williams. I'm a specialist in small animal surgery at Vets Now. I'd like to welcome you to this tour of our emergency and specialty hospital in Manchester. When clients and patients come into the hospital, they're met by our reception staff. Here, there is a dog waiting area and a separate cat waiting area. There are 6 consultation rooms, and these provide access to the main treatment area, so the patients considered to be critically ill can receive immediate treatment. The hospital is based on one floor, and at its hub is the intensive care unit and central prep area. Specialists, vet surgeons and vet nurses are always on hand to receive referral patients and to treat any critical cases that have been rushed in. Among the disciplines we specialise in are soft tissue surgery, orthopaedic surgery, emergency and critical care and internal medicine. We also offer an interventional radiology service which allows procedures to be carried out in a minimally invasive way with the guidance of fluoroscopy. Just to the side of the central prep area are 2 crash units. Each station has a stock of emergency drugs, and within reach there is also a defibrillator, incubator and a small ultrasound machine for point of care scans. Behind the central prep area is the theatre suite. It contains 2 theatres, the fluoroscopy room, a prep area and an autoclave room for the sterilisation of surgical equipment. Clinical staff working in this part of the hospital have access to an array of state-of-the-art equipment, including a fluoroscopy machine and a CT scanner, both of which are well used by all disciplines. The central prep area is flanked by the barrier nursing unit and the isolation ward. This has its own separate entrance and is used to house patients with potentially contagious diseases. Moving from one side of the hospital to another, we go past the pharmacy. It stocks a range of drugs and consumables, including chest drains, feeding tubes and central lines. The pharmacy is also home to our tox box, which contains drugs used in the emergency treatment of poisoning, such as antivenom for adder bites. Canine and feline blood supplies are also stored here. Further along the corridor is the diagnostics area. It is mainly used by the internal medicine team and contains an ultrasound machine, a scope tower for endoscopy and a general anaesthesia station. There is also a laboratory for in-house tests such as blood gas analysis and coagulation times, as well as snap tests for different infectious diseases. Alongside this is the Feline Ward and the Canine Ward, both of which have their own glass-fronted walk-in kennels. As you can see, the main areas of the hospital are almost entirely open plan. It was designed in this way to promote teamwork and to ensure clinical staff can see when a colleague needs help. Behind the scenes, there are also offices, a staff room, kitchen area and a conference room. The offices are mainly used by the hospital management, senior clinical staff and administration staff, while the conference room regularly plays host to CPD evenings delivered by our specialists and referral clinicians. Our emergency and specialty hospital in Manchester is one of the most advanced facilities of its kind in the UK. It is accredited by the Royal College of Veterinary Surgeons and is also recognised as an ISFM Gold Standard cat-friendly clinic. Our clinical team accept referrals from practices across the Northwest. Staff are available 24 hours a day, 7 days a week, to discuss cases over the phone without any obligation to refer. Everyone who works for Vets Now is incredibly proud of the work we do here.